All right, good afternoon. It is just a little after 12:30. This is Thursday, so it is our Team Kentucky update. Today we'll start by discussing where we are in our fight against COVID-19, specifically the Delta variant. Afterwards, we'll delve into some more good economic development, good news, and some good news for some communities that are going to get significant dollars to renovate and upgrade their vocational schools. So first, the Delta variant continues to burn through Kentucky at a rate the likes of which we have never seen. Even with universal masking, we now have 30 school districts that have had to pause at least for a period of time. We look at our stair-stepper chart and we see once again that last week was the worst week in terms of cases since this pandemic began. While not up here, we set records this last week in hospitalizations, in Kentuckians in the ICU, and in Kentuckians on a ventilator, meaning we are suffering the most at a time when it is the most preventable. That we would not be experiencing, we can put the stair-stepper chart back up, we would not be experiencing either this exponential growth, this amount of disease, or any of its repercussions if people would simply get vaccinated, and we could significantly cut the transmission if everyone would wear a mask when they are in public, indoors, outside of their home. And while this is cases, remember, more cases mean more death. While we don't have today's official report back, we think we're going to report 45 deaths in today's report. 37 of those have occurred since August 15th, so that's just in the last couple of weeks. And today's report is going to include a 27-year-old. This is hitting younger people. It is making people sicker than we have ever seen. And we talked yesterday about an individual, or at least I received the information, that went in 5 days from testing positive to dead. And they were fairly young as well. So please, everybody, take this seriously. It's the most aggressively spreading. It is the deadliest variant in our entire fight. Yet, if you drive around most towns in Kentucky, you see us doing less than we were doing at a time when we were fighting a variant less powerful. Let's also, again, look at something we did on Monday, and that's how much more disease, how many more cases we had this August versus the last August. So we went through the specific numbers before, but the magnitude of what we are dealing with now, August of 2020 versus August of 2021, shows you how much more significant the Delta variant is than anything that we have faced. And then who is actually getting the virus? You look at children. More cases in children than we ever thought that we would see. That's nationwide, and that's in Kentucky. I mean, this is a significant increase from what we saw last year. And kids now make up 2.5 times more of the percent of overall cases than they did at the same time last year. That means 1 in every 4 cases, 1 in every 4 positives. We had almost 5,000 yesterday. 1 in every 4 is a kid under 18 years old. That's why we're seeing those school closings. That's why we're seeing more kids in the hospital. That's why we're ultimately going to lose more kids nationwide, and we hope not here in Kentucky. So, spreading like wildfire. It's infecting our kids. It's closing our schools. But you don't have to take my word for it. We have a message from a couple of doctors at TJ Sampson today, pediatric doctors, Dr. Beth Brooks, Dr. Ashley Matney, and Dr. Allison Campbell. And they're going to tell you first that they're seeing a lot more kids with COVID, and second, that they're sicker, but third, that there is an answer to all of this and to protecting our children, and that is vaccination.
I hear a lot that children aren't getting affected a lot by COVID and that they shouldn't look into vaccines if they're 12 and older and it's approved for them. And that's no longer true. At the beginning of the pandemic, we did see that children weren't getting as sick, but right now they're getting just as sick as adults. They're ending up in the same ICUs. They're on vents. They're getting treated the best that we can, but they are getting sick.
I am an at-risk individual myself, and I come into contact with sick people every day. We don't want to be sick ourselves. We don't want our children to be sick. We don't want to feel responsible for spreading disease to our family members.
I encourage other people to get the vaccine because it works. It helps prevent hospital stays. It helps prevent severe illness, spread of disease. It helps keep the people around you safe and keep your own self safe with very minimal side effects or long-term problems.
The best way to protect yourself and your family.
The best way to protect yourself and your family
The best way to protect yourself and your family
is to get vaccinated.
I just want to mention a couple things that were said because I think they were trying to present a positive vaccination message, but I hope you caught in the beginning that kids are getting, in their terms, what they're seeing here in Glasgow, just as sick as adults. They are in the same ICUs. Folks, that's because there's only 2 pediatric ICU units in the state. So sick kids in most regions of our state end up, if they need an ICU, in one that is not designed for them. They are on vents. And to the parents that have kids in that situation, I can't imagine what it must feel like to look at your child needing a machine to help them breathe. Positivity rate continues to be overall at its highest point. It inched down just a little bit yesterday from the day before. Folks, it's nothing to celebrate if we have a positivity rate over 13%. That means we are at the highest. There is the most disease at any time in this pandemic. One reason you see it inching down right now is we are testing significantly more. In fact, we are testing so much there is a crunch at times on supply. You know, what we used to be doing in a month, we are now doing in a week in terms of testing, and that's picking up. That is a good thing. Remember, it's one of the reasons that we saw an extra stress on hospitals because so many people were coming to the ER or the hospital to get tested. And we'll talk again about steps we're taking to help alleviate that. But the positivity rate being at a dangerous place, and don't mistake if this levels off a little bit by meaning that we're approaching the peak. It's more likely driven by the denominator, the number of tests getting bigger and bigger and bigger. And we do need that to happen because just about every day, somebody, you, other people out there are coming into contact with somebody who is positive. That's why the mask is so critically important. Let's just look again at the line graphs to show that the exponential growth in cases also shows up in hospitals. Our hospitals, and we'll talk about them in a minute, are already on the brink. This can't continue. If we have this type of exponential growth, we're out of everything. That's staffable beds, that's staffable ICU beds. We just got 40 additional ventilators from the national stockpile. We had to ask the U.S. government for more ventilators. We have them now. We took some to St. Clair. I believe Advent Manchester needs a couple. We previously delivered some that were older, these being newer. That precipitous climb can result in us running out of healthcare capacity. And already we see folks that probably need to go ahead and have a surgery having to push it off. Why? Because the hospitals converted all surgery space into additional ICU space. When this happens, when we don't reduce the amount of disease we have out there, we reduce the capacity for you to get help for anything other than COVID too. Let's look at the intensive care units. So yesterday, hospitals dipped a little bit from the day before. We'll see. I mean, that was the first day, and I think 44, 45 that had happened. We'll see. But the ICUs set a new record, and we've set a new record after record after record. Intensive care unit is called that for a reason. You're in trouble when you're in there. You got great people there willing to help you out. But again, there is a limit on ICU beds in the state. Right now, we fluctuate anywhere from about 115 adult ICU beds left in the state to about 145. But if you can see at that growth, we have 3 bad days. we have 3 bad outbreaks and we're in trouble. And remember, those are statewide. And a lot of those are in Louisville or Lexington where there is additional capacity. You talk to the regional hospitals, they might not even have an ICU, but they're treating those patients. They got people on a ventilator in the emergency room that they can't stabilize to ultimately move. And those that do, they are full. Let's look at Kentuckians on a ventilator. Again, this is when you're praying for things to go right, the highest that it has ever been. Our information today says we've set a new record for hospitals that are at the critical staffing shortage. This is, you can call it out of space or out of people. This is out of healthcare capacity. 62 of 96. We've reached 2/3 of our hospitals at critical staffing shortage. I mean, it wasn't 2 weeks ago that we were at 1/3, and then we almost immediately went to 50%. These numbers are growing every day. We've got so many people in the hospital. You think about other things that you can run out of. We're seeing shortages of IV pumps and vital sign machines. So now it's impacting even the everyday operation of a hospital beyond just needing the monoclonal antibodies or the oxygen or some individual things for COVID patients. Twin Lake Regional Medical Center. Incredible work by them. This last weekend, we talked about it when a transformer blew in a hospital treating a whole group. I mean, a whole hospital worth of COVID and other patients lost power. They worked with their parent, Owensboro Health, and they were able to transfer everybody that would need power to another facility. Good news is, got power up over the weekend. And here we are into the next week. They haven't brought back any of the patients they transferred, and they're already full again. That's how fast it's spreading. That's an example of a hospital that, if they'd had those patients, would now be looking at probably double their capacity or pretty close to it. I again want to say they did heroic work. Emergency management in the area did incredible work. Those patients' care was never interrupted. In the midst of a pandemic, having a transformer and all your power go down is about the last thing you can imagine. As much as you can take something like that in stride, they did a good job. We currently do not have shortages in oxygen, but we ought to be preparing to have them. We are seeing that across the South due to the surge in patients and the increased need for oxygen demand. Remember when we saw this in India? And we won't see anything like it in India, but they were only treating patients who could bring their own oxygen. The fact that we now have some shortages is being reported and the states hit harder than us is concerning. So we have another message today. Again, we're trying to make sure we branch out into the states so that you can hear from folks in your community about what they're facing. From Cumberland Regional Hospital, we have Dr. Ted Qualls.
Good afternoon. My name is Dr. Ted Qualls, and I am an emergency medicine physician here at Lake Cumberland Regional Hospital. I appreciate the opportunity to speak with you today to share important information regarding our hospital operations and COVID-19 status. Without a doubt, cases of COVID-19 have increased significantly in our hospital and community. Like every other healthcare facility in Kentucky, Lake Cumberland is operating at the very edge of our capacity. Our team has been working tirelessly to care for our community, and we ask that the community please be patient and understanding as we work to respond to this surge with all of our available resources. The hardest part of what we are facing right now is knowing that much of this is avoidable. But with your help, we can turn the tide against COVID-19. First and foremost, getting vaccinated greatly reduces the likelihood of someone contracting the virus, being hospitalized, or dying. If you are on the fence about getting vaccinated, please pick up the phone and call your physician to talk specifically about the vaccine. The overwhelming majority of patients we are seeing in the ER or hospitalized with severe COVID symptoms are unvaccinated. Vaccination is the primary way that we will avoid further overwhelming the healthcare system here at home, in our region, and across the state. We also want to extend our thanks to those working on the front lines of the pandemic, including those here at our facility and all of our local first responders. We also appreciate the assistance of the FEMA strike team, who has been stationed with us since last week. They are helping to transport patients to other facilities, nursing homes, VA hospitals, and in some cases closer to home. We all have a role to play in ensuring that our community remains healthy and that everyone here has access to the care they need. Our staff is counting on those of you listening at home to play your part. But please remember, do not delay essential or emergency care. However, if your condition is less severe and non-life-threatening, please seek care at an urgent care facility or through your primary care office, that our ER staff can focus on the more critical needs. But if you are experiencing an emergency, please do not hesitate to call 911 or head to the nearest emergency room. Thank you.
So every hospital across the Commonwealth, especially our regional hospitals, really push to the brink, needing the helps of their community, all describing their population, the vast majority unvaccinated, and begging people to get vaccinated, to help them out and to protect their community. As we mentioned previously, we're doing at least 4 different things to try to free up healthcare capacity. It's been one of the things I've been working directly on with Dr. Stack and others, trying to see what we can take over in a hospital that frees up as many clinicians as possible and or the most experienced staff to deal with the sickest of patients. The first is we have now deployed National Guard teams all over Kentucky. They've been an incredible partner overall in responding to COVID-19. They've worked as our vaccination team. They've helped thousands of Kentuckians receive their shot of hope. They've helped at our food pantries and continue to make sure our people are fed during these times. We recently got word that we got approval from the federal government to operate them in just about any capacity dealing with the pandemic through the end of the calendar year. So we've asked them to step up once again and to help us in this surge, especially in our hospitals. So we initiated these teams yesterday. The dedicated National Guard Central Command heads this mission, and the deployments will be right now in 2-week increments. The initial deployment were 105 National Guards men and women, 7 teams of 15. Each team has 2 to 3 leads. They lead the operation on site. The locations that they started at are Med Center Bowling Green. There are 2 teams there. St. Clair Regional Center in Moorhead, 1 team there. Pikeville Hospital, 2 teams. We've already heard great things. And Hazard ARH Regional Medical Center, 2 teams. Now, there are other hospitals that are also struggling. I mean, right around the same one, and we're communicating with them on a number of things, is Baptist Hardin, certainly Baptist Corbin, but we have some additional help there as well. Other missions into the fall include mobile vaccination teams, continued food bank support. So we want to thank the Guard. They are now in those hospitals, and we're looking at potentially doubling the number of teams that are out there to help. The goal here is to take all administrative, logistical, management, anything that can free up clinicians or folks to help patients. They're willing to come in and help out and take control of. So that was number 1. Second thing, testing. What we have seen is so many people coming into an ER or a hospital to get tested for COVID. Let me say it again. If you are just needing a COVID test, if you are not very sick, do not go to the emergency room. That clogs up the system for people who are really, really sick or in an emergency. But what we've seen is it's happening. So what we have done in select hospitals and looking to do in more is we've taken over their testing to, again, free up those that were doing it. We've seen it frees up at least 4 to 5 folks that can then transition back into the regular hospital and free up multiple beds. We've got Gravity Diagnostics helping us out again. Remember, this was the first big company that stepped up and helped us in testing when we didn't have any at all in the state. They're helping mainly Ephraim McDowell in that area. Wild Health at UK Healthcare is helping Baptist Health Corbin, St. Clair, and Pikeville Medical Center. So those were 2 steps. The third step was getting FEMA assistance. And we have already, you heard, directly received some of what was requested. Specifically, we were approved for EMS teams here in Kentucky. We have on the ground right now 3 FEMA Emergency Medical Services strike teams. They are managed by the Kentucky Board of Emergency Management Services through American Medical Response. Each team has 5 advanced life support ambulances, right? So 3 teams, 5 ambulances apiece. Each ambulance has a paramedic and one EMT. We have them staged. You heard here in Somerset, Prestonsburg, and Louisville, already having an impact certainly on the Somerset area. They were also ready to help with the Twin Lakes evac. They were able to do that without them, but having them there, incredibly helpful. We're hearing two things. Number one, they are helping transfer patients from hospitals that might not have the ability to take care of someone that's sick to others, but they are also, by doing those things, freeing up the regular, normal, local EMS teams to actually do emergency runs. They're centrally dispatched and can respond to any area in the state. We also asked for nurse strike teams. We asked for 5 facilities, and assessments have been completed by FEMA on those. 3 facilities, St. Clair, Baptist Health Hardin, and the Med Center, qualified for a team. St. Clair ranked as the highest priority of assistance. So we were told that we're going to get a team for St. Clair. We don't know yet when we're going to get it. I pushed, directly made some calls. Certainly Hurricane Ida has created great difficulties with huge needs. No question there are major needs there, but in getting relief to Kentucky. I've made the point that if we are critical enough, and we are at that hospital, to need one of these teams, every day that passes without it is a problem. We're going to continue to monitor the availability of the teams. In a piece of new news today, we have also submitted a resource request form. There's lots of acronyms when you deal with government, an RRF, seeking 2 monoclonal infusion teams to administer the medication subcutaneously. We chose this type. There are multiple types of monoclonal teams that FEMA can provide because we think we have a better shot of getting them. Monoclonal antibodies are the best, or virtually the best, treatment we have seen, especially early on when you had COVID, and there is a need for more people who can administer that type of medication. Lexington area hospitals and Lexington Fayette County Health Department met today to discuss the logistics required to support those teams. The Lexington Clinic has donated a 2-story building across from St. Joe's Main Street, where St. Joe's, Maine, where we would use these teams. We've asked our HHS representative to hold on the request until we could ensure that Lexington can support the teams, and we should be able to let them know today or tomorrow to push that through. What that'll mean is we have an additional center out there, centrally located, where people can come in and get that early form of treatment. Again, that ought to free up more staff at hospitals that won't be doing that, but can be treating patients directly. And finally, this is also new news today, in long-term care, we're working on nurse strike teams. 2 teams are being developed by the Healthcare Associated Infections Program, and they function like they did this past year. 2-week deployments to long-term care facilities with needs. Everything we are seeing in hospitals with staffing shortages, we are also seeing in long-term care. So those were 3 of our actions. The 4th action we were taking is to reach out to our nursing programs that are out there, knowing that we have talented students that are ready and in a time of crisis can provide wonderful care. So earlier this week, I shared a story from a weekend event where a nursing school stepped up and offered to support our frontline heroes in need during this current surge. That offer came from Galen College of Nursing. Today, I'm proud to have the college's CEO, Mark Vogt, and the dean of the Kentucky campus, Lisa Peak, join us along with 4 students, Sophia Allen, Jacquar Morris, Brittany Welch, and Sabrina Hale. Nursing students from Galen are going to be joining hospitals and healthcare teams in need by offering assistance with testing, clinical needs, and other services. This is going to make a huge difference in the fight against COVID-19. And when I called the first 2 hospitals CEOs to tell them about this, they not only got really excited, they wanted to figure out how to eventually keep anybody who showed up to help at their hospital. So before I hand it over to Mark, I'd like to say thank you. Thank you to you. Thank you to all your students that are stepping up. You know, we are at war, and rarely at war does someone make an offer that we want to help, and we can help. And when times are dire, we're willing to come in and fill in the best we can. What you and these students are doing is the true spirit of Team Kentucky. We're grateful for your bravery, your dedication, your caring for the people of Kentucky, your support for our healthcare teams, and furthering education in such a critical field. So for that, as you head up today, we are naming Galen College of Nursing this week's Team Kentucky All-Stars. Welcome.
Thank you, Governor. You know, it goes without saying that we are facing just unprecedented times, not only in the Commonwealth, but around the world. Never before in our history have we ever seen the need for nursing care like we see it today. We are receiving calls daily from our clinical partners from around the Commonwealth in dire need of nursing staff and needs for supporting them. And we've seen this throughout the pandemic. I want to thank our hearts and our minds are really going out to all those frontline caregivers, the physicians, the nurses who are fighting this battle on a daily basis. But not just the practitioners, it's the support teams, the environmental staff, it's the nutrition, it's all the teams that are supporting our healthcare in our Commonwealth right now in some of its most desperate need in our time. We acknowledged at Galen College early on that we wanted to do our part. What can we do to support the Commonwealth and the citizens up here in Kentucky? So we looked at ways that we could participate and provide ancillary services so we could give that opportunity for our frontline caregivers the time to spend with their patients. How could we help support them? As nurse educators, we feel like it is our obligation and our opportunity to give this time for our students to provide that support. In these most vulnerable times, you know, Galen students like Sophia, Saprini, and Jaquar behind me, you know, have spent hundreds, if not thousands of hours supporting the Commonwealth. We've delivered over 100,000 vaccinations with our partnership with the Kentucky Nurses Association. We have administered thousands of tests related to COVID for our students. And we are continuing to do that today. At this rise, and you've seen the numbers that the governor spoke for in the peak of what we're doing, we are getting call outs for supporting our communities that are in very dire need. With our campus in Louisville and our campus in Hazard, our students and our faculty are traveling around the Commonwealth, driving hours to provide a second set of hands to assistance to these facilities to give the nurses just another set of hands. We're going to do this, and we're going to continue to do this. We're going to continue to be here until we're not needed for this role. At Galen, we are going to stand, and we're here to help the Commonwealth. But I want to take this opportunity while I have it to say that it is incumbent upon all of us to do our part here in the Commonwealth. I wish I had the magic words that I could speak today that already haven't been spoken from this podium and spoken from our care providers in our country. We are imploring you to get vaccinated. I know that many of you that are listening to me right now are already vaccinated. I want to ask you to have courageous conversations, to reach out to your family members and ask them to consider getting vaccinated. For those of you who have not taken the step to get vaccinated, it is an easy process. The work that we've been done here throughout this healthcare crisis has made it easy for you to get vaccinated. The evidence is overwhelmingly supporting for you to do this. So we ask you to do your part. We are going to continue to do our part, but it's going to take all of us in this Commonwealth to get through this. So thank you, Governor, for this opportunity.
Thank you to Galen, and thank you to all of our schools that are out there providing support, and I know more will be needed moving forward. I also wish that I had those magic words, but I think that it's exactly right. It's breaking that Thanksgiving dinner rule and having a difficult conversation with someone you love that is not vaccinated. The fact that you were willing to put your relationship with them on the line speaks volumes to how serious this is and how much you care about them. And it may be the one thing that gets it done. Let's look again at our chart on vaccination status of COVID-19 cases. Again, we put this up a couple days ago, but 90+% of cases, unvaccinated individuals, 91.3% of all hospitalizations. Again, it shows us that the number one thing we can do to stop this virus and this variant is get vaccinated. And it offers today, even with the Delta variant and even with more breakthrough cases, more protection than it ever has when you compare unvaccinated individuals with vaccinated individuals. Let's look at the rate of COVID-19 cases and vaccinations. 6 times the protection. That's what you get. You get a 6-fold protection against, this is the Delta variant. If you are vaccinated versus unvaccinated, that is better comparatively than what you got in the beginning when we were dealing with the Alpha variant in March when you got vaccinated. Yes, what we're dealing with is more aggressive. It breaks through more often. But the level of protection that we had hoped for originally, we are getting an even better amount today. Vaccinations themselves now at 2,542,182, little under 8,000 between yesterday and today. That's good because hurt to get the report that I got yesterday, which is about the previous day, and it was only 3,000 and something. And we got to be doing a heck of a lot better than that. For Woodford County, now up to 73% of their population with at least one shot. Franklin County right behind at 72%. Fayette County at 69%. And we need everybody to keep pushing. Today, we're just going to show you the age demographic because we did have some positive change in that. Of all adults 18 years or older with at least one shot. Remember, when you're listening to national news, you got to listen to how they're basing it. We at least want to get one shot in your arm. We're now up to 69% of our adult population. That's gone up a percentage. We ought to keep going. Same for 65 and up, 85%. It's a great number, but 15% of people 65 and up are at great risk right now. 71%, 50 to 64, no change. We did increase 1% for 40 to 49-year-olds, now up to 59%, and 1% for 30 to 39-year-olds. Again, I think next week we are likely to change to the new census numbers that we just got out. That means the denominators, the number of people in those age groups, 65 and up or others, are going to change. So those percentages are going to change. Now, I would generally say the numerator, which is the number of people vaccinated, I would normally say that that isn't going to change, but with this new data download, the federal government is going to be able to place more of our unknowns into the actual age groups and areas that they go in. So when we make that change, do expect those numbers to change a little bit. Do you have the genomic sequencing graph? All right, we're going to show this then the next time that we get together. What it shows is when we look at our sequencing, what we do in Kentucky, what variant are we dealing with? And we're not able to do a lot of it, but we do get a decent sample. In May, we were talking about the Alpha variant and how it made up just about everything. It was making up, about 80% of all cases. That's what we were seeing nationwide. I can tell you as of August, if you looked at that same chart, easily 85% of all cases when we do the genomic sequencing are Delta variant. So we pretty much have just Delta variant throughout Kentucky, sprinkling in a couple of other things. What we're dealing with and what we knew from the national numbers is that Delta variant. Month over month, the last full month in the way we measure, which is not calendar month, certainly was our best for vaccinations in a while. We were over 200,000. We hadn't seen that in about 3 months. So we're living through a couple historic moments that we always talk about, one of tragedy and great difficulty, which is COVID-19. At the same time, we're living through a historic moment of economic progress and entering what I believe is going to be an era of prosperity. And it's tough to be going through those at the same time, to process the highs and sometimes to to process the lows. But every single week we have good economic development news, and we do again this week. I've been saying our economy is on fire, and that hot streak continued throughout last month. In August, Team Kentucky and private sector companies announced plans to create nearly 800 full-time jobs across Kentucky in the coming years. These 14 projects increase the job totals announced this year to over 16,600. And we're not close to being done yet. In addition to creating quality jobs for families, these projects show the companies see Kentucky as a great long-term partner, and they continue to be spread throughout the Commonwealth. Well, in the past, we'd sometimes see a lot of development around the Golden Triangle. What we are seeing now is big projects occurring all over Kentucky. So, Martin Rhea, this week we were happy to see a Tier 1 auto supplier is undergoing a $31 million expansion in Hopkinsville. Announced Monday, this project's going to create 33 high-quality, good-paying jobs for Kentuckians. This is a Canadian-based company. It's going to add nearly 40,000 square feet to its Christian County facility in support of business growth. The expansion is going to allow it to increase production of lightweight, high-strength steel products for both internal combustion engines and battery electric vehicles, an area that we are fiercely competing in. Company's growth is great news not only for the region, but the continued development of our automotive sector. We are a dominant automotive sector state, and we've got to continue to fight as the industry is changing so dramatically and so quickly to ensure our position as a leader. Right now, our auto industry employs about 100,000 Kentuckians statewide. Additionally, this week we celebrated another exciting job-creating project, one that's bringing a new headquarters operation to Northern Kentucky. On Monday, I announced Setco Sales will relocate its headquarters to Boone County, creating 30 high-quality jobs in the coming years. Currently based in Cincinnati, we're bringing a bunch over the river. Don't tell Mike DeWine. Setco manufactures precision parts and specialty products for the automotive and aerospace industries, two of the industries of the future when we talk about emerging industries that we are focused on. So with this move, Kentucky will become the new worldwide home for the company's global operations and management. With Setco's addition to the Commonwealth's business community, the company will join the roughly 4,500 manufacturing facilities operating statewide. Kentucky is a national leader in manufacturing, which employs about 260,000 Kentuckians. I'm so appreciative of both companies for their commitment to Kentuckians. These are only the latest announcements as we build towards a better Kentucky. Thus far, this year, we've announced more than $2.8 billion in new investment throughout the state. That is already more than all of last year. And folks, you ain't seen nothing yet. I think we can potentially double, maybe even more than that, those investments by the end of the year. So some of the big announcements we've highlighted recently included Northern Kentucky operationalizing Amazon Air, the largest project, single project in the history of the company that is Amazon. That's pretty special. It's in Northern Kentucky, 2,000 jobs is what they're hiring right now. In Henderson, largest project in Western Kentucky in 25 years. That is Pratt Paper LLC. They're going to create 320 jobs, $400 million investment. That'll be the cleanest, greenest, most technologically advanced recycled paper mill in the world. Fruhoff, 288 jobs in Bowling Green. Kruger Packaging, 150 jobs in E-Town. Veland North America, new headquarters in Louisville, 75 jobs, and then announced another 75 in Shelby County. Firestone Industrial Products in Whitley County, 250 jobs in the electric vehicle sector. Kentuckiana Curb Company, $60 million investment in Simpsonville, 700 new jobs. Metalco, 60 people at a facility in Franklin. Nucor Tubular Products, we continue to see more Nucor and Nucor-related projects. $164 million tube mill, 72 new people in Gallatin. And in July, Fidelity Investments, biggest one-time hiring that I think we've ever seen there. In Covington, 600 more people at Fidelity. So we are seeing exciting growth. But I got to tell you, we see more potential right now. We see investment sizes that we could have only dreamed of. The future is right here in front of us. This opportunity is ours to grab, to never be a flyover state again, and to be a leader and never again a follower. To do that, obviously, we've all got to work together. We also have to beat this virus. The Delta virus could potentially keep us from reaching our potential. And so lives, education of our kids, but also the future of our Commonwealth with this opportunity in front of us. So finally, yesterday, we made an exciting announcement that advances one of my top priorities, boosting education and continuing this amazing economic momentum we're seeing week over week. We have awarded the $75 million to school districts around the state to fund renovation projects at local area vocational education centers as part of our Better Kentucky plan. Our vocational programs are essential. They provide high-quality education, hands-on experience for our students, growth opportunities for our workers, and a skilled workforce for our businesses. This is how we move communities forward and continue our economic momentum. The funding will ensure that Kentucky workers have access to state-of-the-art vocational facilities to learn skills and trades. School districts approved for these grants are in Magoffin, Christian, Johnson, Lawrence, Fayette, Knox, Trigg, and Ballard counties, as well as Bardstown Independent. This was done by the Kentucky School Facilities Construction Commission Board. They award these grants. Let me say, there were a lot of amazing applications, and we are going to be looking over those other really good applications that the board did not say yes to for potential inclusion in my recommended budget to the General Assembly. These facilities are imperative, and investment in them now not only spurs our economy, but helps us to ensure we have the best trained workforce out there. As we noted earlier about working together, that's where this money came from. It came from coming together at the end of the last General Assembly on a Better Kentucky plan that's going to create 14,500 jobs, provide clean drinking water, provide broadband all over the state, rebuild schools, and do this renovation work. So thank you to the General Assembly. Thank you to our federal government for the American Rescue Plan Act funds that are helping to fund it. And congratulations to these school districts on their success. And folks, if you were close, if you're one of those school districts, let's keep talking. We're going to have a chance to really invest in this next budget, and there were great, great applications. All right, with that, we have, I think, 5 journalists today in person, many more virtually. We'll start with Michael from WLAX.
2 quick ones, if I may. Special session. Are you anticipating will be called so that we can get some common ground here on where we need to be with masks and everything else?
And what's the second one?
Second one's about the Supreme Court's ruling. It's off topic but important. The Supreme Court's ruling in Texas yesterday. Do you think that it's potentially in our future to go that route?
So on the special session, we have been meeting around the clock with legislative leaders to try to come to common ground. And I think we certainly have a lot of common ground. Well, it still remains to be seen what tools, and there are some important tools that I know are a little controversial with some of the majority that they'd be willing to provide us to fight this battle. I do foresee a special session. I see it, soon. We're still awaiting word in whether we have enough agreement to get that going as soon as we would hope. I believe that it is certainly possible that we have a special session as early as Tuesday, but that's not announcing we're having one on Tuesday. I know that rumor has gone around. We're not going to have one on Monday. Again, we're awaiting word back. We have to do a lot of negotiations here, and then they have to go back to their caucus to see where things are. They've been constructive. Yesterday, we had I think a several-hour meeting on school and school-related issues, a lot of common ground, and a lot of things to talk through about what we're seeing on the ground and what other people are hearing. The U.S. Supreme Court ruling in Texas, I think there's a lot of unanswered questions because I think that law is procedurally very different than a lot of others. And so how it will apply, we will see. What I'll say is, as Attorney General, I saw some of the worst evils that the world heaps on people. I saw kids as young as 12, 13, you pick, raped and impregnated, even by family members. I think those victims should have some options. And I hope no matter what direction anyone moves and any state moves, that we can at least agree that they should have some options. Tom Latek.
What all will be on the call? How narrowly will it be tailored with the special session?
Well, we are starting to put together what a call would look like, but we want feedback on where the General Assembly is right now. I can assure you that COVID will be on the call. Exactly what it looks like. Certainly, it's got to be an extension of the state of emergency. That's what all the legislation is about. And then approval of executive orders and continuing. And then there are some tools that I believe we need that they're going to have to decide and whether we get. That's certainly masking, general masking, and whether that is the power to do it when necessary or the power to do it in high transmission areas, right? They may want to look at, when you're a red county, okay, the state can come in and do something because it means it's spiraled out of control. Again, they can look at all of that, but I think that there is a big difference in our outcome and whether we have the authority on masking and if we don't, and that's something they'll have to look at.
Do you have anything else other than COVID in mind to add to the call?
We're still working through any other things that are currently in front of us that we might be able to work through in a special session if we have full agreement on them. But we're not going to add anything that we don't have agreement on. Shelby.
On the topic of flooding, we're still receiving a lot of messages from people living in Nicholas County who are being told that they won't receive, the insurance won't cover any flood damage they may have. What's the status on federal aid for that area?
So we are, I believe, awaiting word from FEMA on the individual assistance side. Let me get you an update on that because that application has been in for a little bit. We've certainly tried on the state side to provide temporary housing. This is actually a different circumstance. Sadly, a lot of times when flooding occurs, people take temporary housing and then they look at where they are and maybe they decide they're going to live somewhere else. This is almost the main street of Carlisle. And these are people who want to go back to their homes, but their homes have been absolutely devastated, as you all have seen. I've never seen flooding quite like that in an area that looks like it would be very hard to flood. My hope is that we can continue to push on the insurance side, and whether that's the Attorney General's office or others. If these people thought they were getting covered and that's the reason they were buying it, it's pretty important. And my understanding is it's primarily one or maybe two insurance companies that are at issue. Joe.
So back to the special session. I know you talked about there are some areas of common ground. Can you kind of expand on where those areas might be? And are you concerned at all about some of the discussion that has been happening in the committee meetings, at least yesterday and even today before this press conference, about school issues, NTI, even masking and masking young children specifically?
So I think that there is a lot of common ground with the tools that we are using to fight it right now. I think some members take issue with certain things, but when you get into the school issue, a lot of it's nomenclature, right? A lot of what people want are kids to be getting real instruction, whether they're in the building or without. And so do you call it NTI or do you call it virtual instruction, and what type of requirements do you put on it? So I really don't think there's as much disagreement on that as we hear, as opposed to people trying to get to the same place in slightly different ways. All I care about is that it works, that a school that has a big COVID outbreak, that the kids are still learning the next day. And we all know what we have in place right now isn't enough, right? Because all these schools are coming offline and they're just saying they'll tack on days at the end of the year, so that's not workable. So I think everybody recognizes that we need, first of all, flexibility on allowing a individual school to potentially be out as opposed to a whole school district. NTI is only entire district. You can't do it individually. And then the second piece is, I think everybody agrees there need to be some more days, but what do they look like and what are they called and what are the requirements in them? And I think those are all legitimate things that people are trying to work through in good faith. On masking, I think people need to be very careful about picking and choosing. House Bill 1, when they passed it, they said that they didn't want to do that, and so they were going with the CDC. CDC says masking 2 and up. And so if in this instance you say, well, we like World Health Organization at 5, do we then start comparing them each and every time? And how do we pick? Do we pick off just some observations that have been there? Or do we ultimately try to follow the best advice that's out there? And listen, everybody knows a 2, 3, 4, 5-year-old, oftentimes a 9 or 10-year-old, isn't going to wear their mask perfectly all the time. But the more that they can and the level that they can provides protection to that person in the classroom. Remember that childcare worker is surrounded by unvaccinated individuals because they can't be, right, at their age all day long. That gives them a higher likelihood to have a breakthrough case when this is spreading through children. And in the end, if they choose to change that to 5, okay, that's better than not having one at all. But it's going to really, we've already seen it, it's going to really compromise the daycare centers about what's open and what's not open. And then I think there was some discussion on quarantine rules, and I think that there is some room there, but only if people are masked, right? If you say we want to cut down on the number of days if you're taking X number of tests, that's fine. But if it can take you 3 days to test positive and you're not having to wear a mask, my goodness, by the time you would finally test positive, how much exposure could you have? So all these things work together, right? I mean, fighting COVID isn't easy. And so these are now the heavy decisions that the General Assembly is having to make. And listen, just like every decision I've had to make, there's life and death at issue. And you're going to be able to look back and say, if we didn't allow X or Y, here was the result. We're going to be able to do that at some point. Laura.
Can you talk a little bit more about the new businesses and we have labor shortages across the state. And are these new employers worried about being able to staff their new facilities?
Well, there's certainly general concern out there on workforce, but when we are announcing these, it means that the businesses believe that they can find the workforce. I talk to 4 or 5 employers every day. Sometimes we intentionally schedule calls to talk to them. Other times it's more natural, and we're seeing different experiences. The more that businesses that are trying to adapt to a new climate, a whole lot of them are finding ways to get new applications in and people at work. And that's not always just pay, but that's what people go to the most. It's also the field that you're in, what you're doing. You look at App Harvest, and they had almost 6 times more applications, 10 times more applications than they could fill, and that was in the middle of the pandemic. And I think what that shows, and let me back up. I think what that shows, the fact that the states that left the additional unemployment early didn't see much change. The fact that back to work incentives, and we haven't seen our program yet, but across the country might not have seen as much change as we need, shows that we're dealing with something a lot more complicated. We're dealing with major things going on. I think there are a couple that I'd point out. Number one, the baby boomers retiring is big. I mean, these are folks that work 40 years in the same job or more, and that's really hard to replace, and it's all happening at the same time. It probably would have never happened, but COVID came around, and that changed people's mind. So because of the boomers, on the other end, you had folks that have only ever had to work in a gig economy, working 5, 6, 7 different things, and now we're asking them to show up and do the same thing for 40 years. I mean, that's a little different. We have too much disability in Kentucky. Too much of our workforce can't work because they're not healthy enough, and that's an area that we need to address. And childcare is huge. It's huge. And as we look going forward, certainly we're dumping a lot of money, and it needs to be, into encouraging more providers and expansion of providers. But I think as we look forward, we also need to look at more company-owned, company-led, company-operated childcare if we want to get women back in the workforce at the level they need to be, and men too. But that connection, as we've seen in COVID, when the rest of the world is going crazy, even creates even more of a bubble around you, the kids, and the people at work. So I think those are some of the issues, but I think we're all, as a community, coming to realize the more complicated nature of what we're facing. And I believe, listen, we're taking on a pandemic. This is a challenge, but we'll figure it out.
Quick follow-up too. With the was it 75 million with the tech schools? Is that obviously those students could feed into some of that industry? Is there a formal arrangement between the schools and the businesses, like Toyota has some?
Right. So for that $75 million, no. Those are locally owned vocational centers. But you're pointing to something that we're looking at in as we move forward, and as we look at how we do workforce training. For many years, we've said we project we're going to need X number of engineers and X number of welders, and thus we're going to increase sizes in our schools, right? And then it's up to the company and the individual to find each other. And we need to look more about sourcing positions that companies have with the programs that people are going through, almost filling orders for labor, more so than just trying to simply project and increase class sizes. We've had some initial conversations with businesses. They'd be really excited about this, different training programs that could be too. So we're trying to be disruptive is now supposed to be a positive word. I tell my kids that they're disruptive, and I don't mean it positively. But we're trying to think very differently because we're in a totally different age on workforce. All right, virtually, we got Corinne Boyer from WEKU. Do we still have Corinne? We can come back. Do we want to do Jared Benner from WFPL?
Hey there. So we reported a few weeks ago the amount of money Kentucky gets in commissions from phone calls to prisons increased last year during the pandemic. I was wondering if you could tell me a little bit about that decision to raise commissions, and with visitation now suspended at a few more prisons, what's being done to keep costs of staying in touch down?
Yeah, I think the reporting pointed out something that ought to be concerning. We need to provide more opportunity, especially when visitation isn't there, to connect with loved ones, especially with all the scariness going on around us. At the same time, I think it showed that it needs to be cost effective and assuring that we don't make it prohibitive for those individuals to reach out. I do need to reach out and check with the facilities that are limiting visitation again. I know we don't have many of them because they do need to be offering more options. Let me just say, for our incarcerated Kentuckians, and I know we incarcerate some that are outside, they're getting vaccinated at an incredible rate, and thank you if you're watching for it. So much so that we have seen some really incredible results right now. We test wastewater coming out of prisons, and we can now do it to a very minute amount to determine how much COVID is in a prison, and it has been really positive in how much we've been able to keep out. The Delta variant, of course, is concerning, especially in congregate settings, and not enough of our corrections officers are vaccinated. We're still trying to figure out how to do better there. Alex Akisto from the Herald Leader.
Hi, Governor. So you say more than 2/3 of the state's 96 hospitals are experiencing critical staffing shortages. A lot, like I can infer what that means, but can you talk specifically about what constitutes as critical? And also you mentioned that state has requested 40 ventilators from the national stockpile. What else have you all requested so far directly related to COVID? Thanks.
So directly related to COVID, we have requested 100 nurses. Those are nursing strike teams that we requested. We're going to get one team at some point And I think one team is 10 to 15 people. We requested EMS strike teams. We requested 5 total. We've got 3. They are already on the ground. The ventilator request came because our state stockpile is older. We did pay to have them all checked out last year to make sure they're in working order, but some of them haven't performed very well. So we wanted to make sure we had the newest and fully functional on hand. And we've now had at least 3 hospitals that have needed additional ventilators, all regional hospitals dealing with sicker patients than they ever have. The monoclonal teams we have requested, and I'm trying to think through all of our most recent requests in addition to that. There's IRS issues or potential with law enforcement, retired public servants, maybe even teachers that we think we're around that coming back to work at a time like this. And so we've requested that the federal administration work with the IRS on that so that we can get people filled in. I think those are the ones that I can think of right now. Critical shortage is in many ways determined by the hospital themselves. No hospital wants to say they're critical in terms of staffing shortages, and they all took a while to reach that. And what I believe is it means that not only do you know you don't have enough staff, but you are terribly worried about the next day and what that could mean. It certainly means you don't have enough staff for your entire capacity that is there. In other words, if you have 100 beds, you couldn't tend to 100 beds because of the staffing that you're in. I'll also get Dr. Stack on that, and we'll send that to you. Brea Jones, and I think I mispronounced your name the last time. I apologize if I missed it this time. I want to fix it.
It's Brea, like
Brea.
rhymes with Maria.
Got it, Brea. Thank you.
And you said earlier that we're also getting quite short on IV things, and then as well as like vital machines. Is that something that we could request more of the same way that we're doing with the ventilators, or is there a way up for hospitals to get more of those?
Well, right now, we believe that we may be able to just purchase those, that there might not be as big of a run out there. And the very first thing that we always try to do is through normal hospital channels and others. So right now, at least it hasn't been raised to me that there is a shortage, that there is not a way that we can adjust. But I think it makes the point that means we have that many people in the hospital, that we don't have enough vital machines to connect to those that need their vitals taken on a regular basis. That's in many ways, we're not running out of beds, but we're running out of people, and we're running out of the different tools and equipment you would use for a sick to a very sick person. So we got more people in the hospital, and they are sicker than they have ever been comparatively in the inpatient census. So that puts a strain on all the rest of that equipment. Sarah Ladd, Courier Journal.
Yeah, thank you. So I'm not sure if this has come up yet in talks with, yeah, can you hear me?
I hear you.
Okay, sorry. So I'm not sure if this has come up yet in talks with Dr. Stack and the team, but as we kind of get into September here, what should we be expecting from flu season? I know last year it was pretty much non-existent, and this year things are a little bit different. Are we expecting a normal season, worse, or perhaps lighter again? Thanks.
So I think it all depends on masking. We showed last year that when especially our kids are wearing a mask, we can eliminate flu season. Eliminate it. I mean, absolutely incredible, something we never thought we'd see anymore. But as we took off our masks, we're seeing more respiratory viruses amongst kids. And so I think the policy decision that'll be made by the General Assembly, or at least the latitude on that, is really going to determine the type of flu season we see. Now, if we have a lot of flu, that's going to complicate what we're dealing with already significantly. Symptoms are similar, even more need for testing. And remember, the flu takes its toll on a lot of kids and a lot of people too. And we don't have a lot of room right now for those that would need more help. John London, WLWT in Cincinnati.
Yes, Governor, there are reports that according to a union survey over here in Ohio, a third of the nurses at the UC Medical Center could quit because of the vaccine mandate. Ohio doctors talked today about how exhausted staffs are. What is the state doing to try to head off any staff defections as the deadline for flu vaccine nears?
Well, admittedly, these things aren't easy. It's incredibly important that our frontline healthcare workers are vaccinated for their safety and for the safety of those individuals they come into interaction with. And I know that's tough, but it's absolutely necessary. And candidly, if there's not some other reason out there, I have concerns if that frontline healthcare worker that I'm talking to is not vaccinated because of Facebook or because of some crazy things that are out there. And so I think we have to really think about that too. Admittedly, on the flip side, you got to have a workforce, and you got to confront that issues. If we had a mandate right now for our corrections officers, for instance, we wouldn't have enough people to safely operate our prisons. Those are the realities we face. There is no easy answer, but I would say it is incredibly important for our frontline healthcare workers to be vaccinated, and I support all the major hospital systems in Kentucky that are making it mandatory. We'll deal with what comes. We got a lot of people in here that are willing to step up and help out in the interim. And if it gets more people vaccinated, the better. Look at the NFL, and I know that's different, but you had a whole lot of people push back initially, and almost the whole league is going to be vaccinated by the time they start. When an employer steps up and does this, it ensures that this isn't red or blue, it's green. It's green for the individual about their job, but it's also productivity for the company. I think about Tyson Chicken, which also has mandated the vaccines. I watched just the first variant, not even the Alpha variant, ravage some of their facilities, and they worked hard to stop it. For them, the productivity and the impact on their bottom line, if their folks aren't vaccinated, could cripple an operation, and it could cripple a hospital operation as well. All right, with our last question, we made him wait a long time. Al Cross, Kentucky Health News.
Thank you, Governor. Yesterday in a legislative committee meeting, there was discussion of an option of test and stay, or perhaps you should say stay and test. What do you think of that option?
I think I got the whole thing. Test and stay is interesting concept. I know they're doing it in Greene County. I heard about this from folks I know there as well as others. First, if you're going to do it, masking is a must, right? Because if you're going to have people that were in close contact, but you're going to test them, and as long as they're negative for a certain number of days, they could still be in school, for instance. The masking there is an absolute must. There's no way you could do it without it, because by the time that person tested positive, how much infection is there out there? Second thing I'd say is if test and stay is a good model, it shows how important masking is and how it prevents the spread, or at least reduces the spread. But I think that these conversations on quarantining are conversations that can occur, and conversations that I think the Department for Public Health are open to, but they are all interconnected with vaccination rates, with whether we're wearing masks and when, and a number of other factors that may include ventilation. There's also a scale issue. We were talking yesterday with folks about some of the larger school districts and what it would take. And then there's also, I think we identified a knowledge gap with what's available for schools. We've locked in vendors for every school system if they want to use it to do testing. I'm not sure all of them are aware that they can directly reach out to any of those groups and that there is funding available. But those are the conversations that I think are legitimate and that we could have. All right. I said that was our last question. It wasn't. We got Corinne Boyer, who we weren't able to connect with in the first try.
Hi, Governor. Can you hear me?
I can hear you.
Great. What are the state's projections showing as far as how soon hospital ICUs might be completely full? If that happens, what else can the state do that it's not already doing?
So our ICU numbers bounce around day to day. I get them every morning, and they're the best estimate. And I'd say the last 3 to 4 days, we've gone anywhere from 115 beds available, which is concerning, to about 130 or 145. As you can see by those graphs, we have 3 or 4 bad days, and you could fill those up. But it's not just that we have them available, it's where they are, right? A whole lot of those beds are in urban cores at the moment, when a whole lot of the need and where people are when they first show up and are sick are in our more rural or regional areas where they're already full in their ICUs. So certainly on a hospital by hospital basis, we got a whole bunch of hospitals that are entirely full in their ICU and or don't have one, and they're entirely full in their emergency room. We're still looking for every option we can. We're really excited about our nursing students and how much help they're going to be able to make. And we're trying every single day with that next idea, oftentimes, which require conversations with administrators who are so busy. We got to steal time late at night to have those conversations. But I'll say taking over testing came together real fast. We realized that it would work, and we deployed it. So I hope when we come out of special session, whenever we're able to have it, that there is the recognition there. And I think that there is about some of these things have to operate quickly and can take some funding to make work. All right, we went long today. We appreciate everybody being here.
Could I just ask one follow-up?
Throw in one more. Now they're all going to ask questions. All right.
Just one.
You got to tell them afterwards, Joe, that this is totally off protocol.
Just to follow up, what you were talking about, Carlisle, because of what happened now in Louisiana.
Yeah.
At the major northeast cities overnight, or they're.
Yeah.
Yeah. Do you worry that Carlisle will get put on a back burner somewhere in Washington?
I hope that Carlisle will not be put on a back burner because of IDA, because of where the decision making is. We don't have FEMA folks on the ground doing the inspections. They've already done that, thank goodness. So it'll be about whether the decision makers that approve or disapprove of the request have the bandwidth, and then it's got to get in front of the president too. So I don't think that the personnel that are down there change it. Now, I do have a little bit of worries of when the person can show up to process the papers once we get the yes. But on the whole, we haven't gotten any confirmation of that yet. Now, I will say that it's impacting us in a lot of other ways, and our heart goes out to them. And then we also realize that they're in a tough spot, and our country's in a tough spot with everything we are seeing. But we'll continue to push through. We'll continue to do everything we can for those residents. Thanks.